Good morning. Welcome to Best of Both Worlds. Today is our Christmas episode. And so, Lee, what would you like for Christmas? Stand up and show us what you'd like for Christmas.
It's a joke, but...
Lee wants to be single and to what?
Ready to jingle.
And ready to jingle.
He wants to be single and ready to jingle. Okay, that's not going to happen. But something that is in your future is to get rid of this bald patch, right? Is that what you want for Christmas?
Yes.
Okay, so Lee recently had a little tweak. I'm not going to say what it was. You all can guess and speculate. But so what we're going to do is we're going to get rid of this little patch of bald area. Now, one of the things we do a lot of at Contour is to do hair restoration. So if you're having problems with your hair, we can do medical evaluations to see what the cause of it is. And we can also do hair transplants. We have a thing called the Capitalist, which is a light device that helps to regrow hair. We have medical treatments. We have PRP. We have so many things. So what we're going to do is we're going to take out this little bald patch because we've determined that he probably has no hair follicles left. So this patch is not coming back. After that, what we're going to do is we're going to fill in this little scar that we make with hair follicles. We're going to use the neograft technology, which is a system where we take individual hair follicles from the back of his head, which is resistant to hair loss, and we're going to transplant them into the scar. Now we'll wait about 6 weeks, maybe a couple months, before we put them in because we want the inflammation to disappear. Okay? So he's already been pre-numbed, so hopefully this will not hurt at all. And we have a little bit of time because the epinephrine in there will help to constrict blood vessels. And we have our elf assistant, Brenda. Brenda, tell us why you were resistant to wear that hat.
I wasn't resistant.
You were a little bit. Why?
Because I'm short. He was making me be at home.
So she thought people might make fun of her for being short and being not. But I think it's good for you. Okay. So are we live here or what are we doing here?
Yes, sir, we are.
Okay, so we're live. Do we have any viewers?
We do. We have you.
Oh, good. Excellent. Yesterday we scared off some viewers with our jokes. We scared people away, so we won't tell any jokes today. Because this is serious stuff.
Hi.
Okay. So now Lee, what we're going to do is when you're doing surgery in the scalp, you have to be very careful of the direction that you cut because we don't want to transect or cut any of the hair follicles because if you do, what happens is you possibly could kill those hair follicles. And that may be what started this phenomena in the first place. So what we do is we want to just cut out this little piece and we're trying to mind the direction of the hair follicles. We don't cut any.
Ouch.
Sorry. Can I get a little bit more numbing for poor Lee here?
Just towards the back.
Back there? Okay. This is just lidocaine with epinephrine. Stick. And at Contour, we don't want anyone to have any pain because that'll scare people away. And I am also a huge baby when it comes to pain. So I'm very sympathetic for people that are nervous or worried about pain. Okay, so we just make that simple ellipse here like this. Okay, thank you, Brenda. And so then we're just going to cut out this little piece of skin. Very easy. The thing that makes surgeries on the scalp the most complicated is the bleeding. And fortunately, we numbed them up early so that epinephrine took effect, because we don't have to worry about it too much. So next thing we're going to do is we're going to do a process called undermining. And all that means is we want to loosen up the scalp. Oh, we do have a little bleeder there, Brenda. Our little elf. So we're undermining so that the tissue will slide together very nicely and so it won't bunch.
It looks good, Lee.
Thank you.
How's the pain, Lee?
I don't feel a thing, but the sound is horrible. From the crunchy.
Okay. So do you see that little bleeder?
Mm-hmm.
Here, can you see the bleeder there?
Yes, sir.
For some reason, people like to see the bleeder. Where is it?
Right in the middle. I'll let go of it.
Oh, there we go, right there. Did we get it? I got it. Okay. So I like to use clamps to bring everything together because it keeps it nice and keeps the tissue aligned nicely. There we go. Now we're just going to put in a couple sutures.
So how long will you have the sutures in, doctor?
Go ahead and plot. On the scalp, we keep sutures in for 7 days, 7 to 10 days, excuse me. So we'll probably do a full 10 days. And these are called buried sutures. These are absorbable. They usually dissolve within 6 months, but sometimes they'll spit. And that means is they start to work their way through out of the deep part of the tissue to the surface of this tissue. And that's totally normal.
And as far as like washing his hair and everything tonight, is he allowed to do all that?
Well, these are great questions. So the answer is, what we try to do is we try to keep the area dry for 24 hours, and then after 24 hours, he can go back to living his life. Oh, I'll wait down, please. Thank you. And the risks with a procedure like this are really minimal. There's a small risk of shock loss to the surrounding tissue from the surgery, but usually that's not going to happen unless you're doing a hair transplant. Shock loss means that the surrounding hair follicles get inflamed and may temporarily fall out. But in this situation, we're not really getting that close to those remaining hair follicles, so it's very unlikely to occur. And then there's a risk of an infection, but the scalp is very, very vascular, so we rarely see infections in the scalp. And we want to get it nice, the scar to be nice and tight. There we go. Great. And in the scalp, some people believe that the deep stitches like this could traumatize some of the hair follicles in the surrounding area, so we have to be really careful that we don't crunch too many of these hair follicles that are there. How are you feeling, Lee?
Good.
Good. I can't see the bald spot is almost gone just from this little treatment here.
Can I keep my bald spot? Just kidding.
Yeah, absolutely.
As a
Right up
as
for-
a souvenir.
Right up for Christmas dinner or Christmas breakfast. Okay, so we got that. Now we're going to put in the superficial sutures. And with this, you can see how quick this process is. We're just going to try to align the tissue so we have a minimal scar. And we're going to use an interlocking suture. And this suture actually is used to minimize the amount of bleeding that can occur. Okay, go ahead and cut. Eye.
Okay, and I have another question. People always ask, what's the difference between sutures and stitches?
Sutures are stitches. It's exactly the same thing. Yeah, see, we want to get the skin edge to be lined up perfectly. So we don't want any step off, otherwise the scar will be more noticeable. There we go. And, you know, people are always worried about discomfort after surgery, and typically there's minimal to no discomfort. And if you do have a little bit of discomfort, you can just take a little Tylenol and that should take care of the problem. Now, for people who are super sensitive, I always give them the option to have Vicodin or Ultram or something like that, but it's really not necessary for most people. Let's see, we're doing that nice interlocking suture though.
I had no idea how easy this would be, actually.
It's really easy, right? You were worried about it.
Like from a patient perspective, the scariest part was the numbing needles at the beginning, and the rest is just sort of sitting here and
Playing peekaboo?
yeah,
over this?
feeling people touching your head. That's basically all I feel right now.
Do you feel any tugging or not really?
I feel tugging, but it's not painful at all. It just feels.
Okay, well, we want this to go in between here. And aftercare is really, really simple with this. You just want to keep it dry for 24 to 48 hours. And then after that, you can start washing your hair. You know, for most open wounds, we like to keep them moist because moist wounds heal faster than dry wounds. But in this case, because it's in the hair, you don't necessarily have to do that. But Lee's pretty fanatical about his wound care instructions, so he'll probably be he'll have a greasy head for a couple days. I like fanatic patients because they are very compliant and always do the right thing. Now you can see we've got that suture lined up beautifully. We're just going to do our final stitch here to lock it up. Perfect. And it's nice to use the dark stitches so nobody's going to actually probably even notice that he's had anything done. Okay, go ahead and cut. Okay, so now we'll just take it out. And there's a little bit of bleeding. Can I get a little bit of water here? You can see there's minimal blood loss from this, just a tiny little bit.
Lee, how do you feel?
Great.
Now the other thing that will happen is he'll have just a little bit of swelling that will occur. That should resolve in 7 to 10 days. And it's a Christmas miracle because that bald patch that he had now, who's going to see that? No one. Now, because Lee's worried about this hair loss situation, we have Lee on Propecia, which is a pill that you use, which helps to regrow hair, fatten the hair follicles that you have, and keep hairs from falling out. We also have Lee on Rogaine, and how often are you using the Rogaine, Lee?
Twice a day.
Twice a day. And Lee actually decided also to use Latisse, which is used for saving eyebrows, but he's using that on his head as well. And are you taking the hair and nail vitamins?
Not yet.
Not yet. So we're going to get him the hair and nail vitamins, and also they're called Anacaps. And I love Anacaps because they're a special formulation that helps to regrow keratin. So it's great for nails and also for your hair. And so I'm very fussy about the one you get. A lot of people like just to get the biotin, but I like Anacaps because it has zinc and a good blend that helps your hair regrow. And then we'll also get you the Ducray system, which is my favorite for hair regrowth. So thank you all for tuning in.
Thank
Happy
you.
holidays.
Happy holidays.